Hello and welcome to an informational video provided by the Wisconsin Nurses Association and the Wisconsin Environmental Health Nurses Coalition, a mutual interest group of the Wisconsin Nurses Association. Today's presentation, Environmental Hazards, Plastics, is presented by Dr. Kathryn Lammers and Jessica Christy, Leah King, Ashley Lewis, and Dani Bachmann of Winona State University. For more information on the Wisconsin Nurses Association and the Wisconsin Environmental Health Nurses Coalition, visit wisconsannurses.org.
Nurses have a responsibility to be an advocate for patients. One part in doing so is educating patients on the environment, including the use of plastics. This presentation was done by Jessica Christy, Leah King, Ashley Lewis, and Dani Bachmann under the guidance of Kathryn Lammers at Winona State University. So what is an endocrine disruptor? An endocrine disruptor is a chemical that mimics or blocks the effects of hormones. An example of this is birth control. Another example is air pollutants, heavy metals including mercury and lead, cigarette smoke, and fossil fuels. In this presentation, the focus is on the effects of plastics. An easy way to learn more about the effects of plastics is to watch the movie Bag It. An important chemical when discussing plastics is DES. DES is an estrogen created for the use in women to prevent abortion, miscarriages, and premature labor. However, studies have shown that this chemical was linked to vaginal cancer in the children of the women that took this drug. So how does this relate to plastic? Well, DES is linked to plastics because it was manufactured in the exact same lab. So it does have the potential to cause the same negative effect. BPA is one of the most commonly found chemicals in plastics. Because of this, 93% of Americans have BPA in their tissue, according to the CDC. This causes many health risks, including breast cancer, prostate cancer, chromosome sorting errors, insulin resistance, reduced sperm production, early puberty, and child learning and behavior problems. Some sources for exposure include water bottles, plastic dishes, and food storage containers. You can decrease plastic exposure in your life by eliminating the use of plastic. Listed here is the Dirty Dozen. The Environmental Working Group has identified 12 of the most toxic chemicals associated with endocrine disruption. And on this list are two that plastics are included in, which are BPA and phthalates. BPA and phthalates can become estrogenic once inside the body. This can have profound generational effects. Frog TV has videos that you may want to look into as it demonstrates the effects on the environment and certain animal species that are experiencing the early negative effects of endocrine disruptors. Examples of these chemicals include Agent Orange and DES. It is important to be aware that BPA is a toxic agent. The more we study, the more we can understand, and the earlier the precautions are taken, the better. So who is susceptible? Sometimes susceptibility is increased during developmental stages such as the fetal stage, infancy, early childhood, and puberty. These endocrine disruptors from plastics can cause harmful developmental differences in individuals. Some adults have also been found to be more susceptible as well. So what can we do? The main intervention that we as nurses can implement is to decrease our use of plastics not only in our own lives, but in the environment overall. Some examples of this could be decreasing the use of plastic water bottles, warming up food in non-plastic bowls or containers, and bringing your own reusable bags when grocery shopping. In hospitals, nurses can advocate for food that is plastic-free. You can learn more about healthcare without harm by visiting their website and challenging yourself to become more informed about plastics. So here are some links to professional organizations that can contain additional information about plastics and how to become an advocate for decreasing exposure to plastics in the environment. Join us with the American Nurses Association and be a part of the Wisconsin Environmental Health Nurse Coalition. We have stayed active for over 5 years by bringing speakers to the annual conference and providing support for certain legislation and working with other environmental groups. Through our leadership meetings at the annual conference, we have been able to support environmental risk reduction.